Hello, welcome to our testing and experimentation facility for health, AI and robotics, TEF-Health Service Provider Webinar Series, Session 2. My name is Petra Ritter. I am the coordinator of TEF-Health. TEF-Health supports healthcare enterprises coping with the complex regulations in Europe. Specifically, the AI Act is a novel regulation that poses strict requirements to new AI-based technologies before they can enter the EU market. All medical devices containing an AI system are classified high risk as of the AI Act. And this comes with the obligation for CE certification concerning AI Act requirements. And this novel certification comes with challenges for companies. First, there is a lack of concrete guidance on how to implement the regulation operationally. Second, there is a difficulty of converting the legal requirements into concrete technical specifications. And third, there's uncertainty about how to start the development of related workforce and skills in companies. To support companies with these challenges, the European Commission and member states have established TEF's testing and experimentation facilities in different sectors. TEF-Health has been established in 2023, and as of the AI Act, TEFs provide technical and scientific support for providers and notified bodies. Specifically, TEF-Health bridges the gap between industry, higher education, and healthcare providers. TEF-Health is comprising presently 9 member states and 52 partner organizations, private and public, providing their services and development capacities. TEF-Health will be a permanent infrastructure in Europe with more member states and organizations to join. And importantly, TEF-Health already now supports companies from the entire European Economic Area. TEF-Health offers all kinds of support services via a single entry point, tefhealth.eu. Thus, TEF-Health acts as a flywheel, bringing innovations to the market in Europe faster. And presently, we have 342 services that can be discovered via our website. Importantly, we support innovations with a technology readiness level of 6 or higher. That is, the innovations are in a state of validation and testing and certification. All the services can be discovered via our website. You can just click the button, search for services. And many of the services that we are offering come with discounted prices. And for this, you can just go to apply for discounts and you will find the different open calls. For example, we have an international call with service providers from all over Europe, and you find the criteria for applying in the documentations via the link here. Now it's my pleasure to welcome 2 of our service providers from the IHU Institute of Image-Guided Surgery in Strasbourg and FAU, Friedrich-Alexander-Universität in Erlangen-Nürnberg, to present their specific services that can support your enterprises. Thank you very much.
Well, thank you, Petra, for this introduction. I will now present IHU services. So my name is Jérémy Exter. I'm a project manager at IHU Strasbourg. IHU stands for Institut Hospitalo-Universitaire of Image-Guided Surgery. We are a translational research institute to support innovative medical devices development for surgery, from the idea to the validated proof of concept. We have a main focus on AI, robotics, and augmented reality. As you can see, our infrastructure are mostly divided in 2. In red, you have all the clinical parts. So with the ground floor where we welcome the patients, the first floor where we have our 9 hours that are available to do clinical study. On the second floor, we do mainly our research and our startup incubation. And on our third floor, we have our preclinical hours So we have 5 hours that are dedicated to the preclinical study. Yeah, what problems do we solve at IHU for you SMEs? We are helping you to achieve your AIMD, so your AI-based medical device, by providing anonymized medical data for your AI. It can be curated and labeled by your teams. We can provide you GLP preclinical testing, clinical testing, and we can support you thanks to our know-how on AIMD development. And as a statement, we have chosen to make our infrastructure and expertise available to accelerate translational research. So our solution is divided in 3 parts, 3 business units. The first one is about data. So yeah, everything that I will describe afterwards is tailor-made for you, so you can pick only some step of the way or all the way. It will depend on your needs. Regarding the data, first we do a needs analysis to be sure that your device is not techno-push only and that it will fit needs. So we stand with our medical teams and experts to be sure that your device will bring something to the patient onto the market. Then we collect the data to provide your AI for training. Then we curate that data, so we ensure that it is representative of your target population. Then we label the data to train your AI, and we force the final dataset to send it to you and do your AI versioning. In the meantime, as it is a long process, we can do in the first step of the way, starting the data collection, a quick and dirty dataset that is already curated and annotated, so you can benchmark your AI or even train it for a bit to do a feasibility study on your side to be sure that it will be doable. I say that you develop your AI, but we can also develop it for you because we have partners that can do it, subcontractors, one which is industrial and another one which is academic. And then once you have your AI, we go to the proof of concept. This part of the business unit will be certified before the end of next year, ISO 13485. So regarding the proof of concept, we go on the clinical study, preclinical study parts. Same as earlier, everything is tailor-made, so you can choose what you need us to do your preclinical study. So we can provide several parts of this preclinical study. For example, we can ensure the maintenance of regulatory authorization related to the activity. We can support you during the procedure, thanks to our surgeons, nurses, and anesthesiologists. We can manage the platform logistics. We can write the ethical protocols. We can manage the animal facility, and we have to because we have to be certified to use animals on platform. We manage the customer relationship, and we can even harvest organs on living animals to reuse them to do your testing afterwards. Regarding the preclinical installation, we have 5 hours, as I was saying earlier. Each hour are hybrid because we have different imaging modalities in each hour. We have a CT scan, an MRI, an Artis Zygo, ultrasound tower, and laparoscopic and echo-endoscopy tower. Our team are used to work on various topics, and we start up an SMEs because yeah, we are certified GLP on that part. Then once you have done your preclinical study and demonstrate that your device is safe, we can move to the clinical study, so with the first in man, and then with an investigation. Our clinical study are mainly focusing on improving patient pathway, medical device testing, data collection, and innovative surgery protocols. So they are used to it. We have them helping us in our project and also on subcontracting parts with partners that are industrial. Regarding the clinical study, we depend on the hospital next door. So our team is dedicated to do all the paperwork on the operational part. So they are the one getting in the OR to test your devices, and they are the ones that are filling the paperwork. So we are not the sponsor, but we are kind of like a fast track to a clinical study, because we all know that there is some kind of traffic jam at the entrance of main hospital. So it is some kind of way to do it faster. So what does our client say about us? As you understand, you can test your AIMD from the IDEA to the validated proof of concepts in the same environment. So that will reduce your time to market, because you won't have to search for partners on each step of the way. Then you can also benefit from skillful experts who already know how to support you through your AI development and medical device development, because we already do so on several projects and with several industrials. And you can benefit from our partners' networks too. Just before concluding, a small example of what we already did, for example. So with Mediglab Scientific, IHU founded a joint venture to develop a solution to detect pancreatic cancer earlier, thanks to EUS assisted by AI, because EUS is a complicated way of doing diagnosis. So the AI assistance is really recommended. That way you know what kind of lesion you are seeing, on what part of the organs you are. And so to do so, IHU provided the multicentric data collection parts, a data curation, data annotation for several hundreds of videos. And then Mediglab provided the AI development. Then we did the preclinical testing, where we build a phantom specially for this case. And then now they are in CE marking process. And with the first feedbacks, we know that everything is going well. So they will soon be on the market available. If you want to engage with us, you can go on the TEF-Health website. As Petra was saying, you can choose in organization, the country France, and then you can go on the Fondation de Coopération Scientifique, so a really French name, and you will have our list of services as below. If you want to engage with me directly, you can send me an email, and I will gladly answer to all of your questions. Thank you very much for your listening.
Thank you very much, Jeremy. And we directly continue with the next presentation by the Erlangen University.
Yeah, sure. Let me set up first. Okay. Then thank you for giving me the opportunity to introduce the role of FAU and TEF-Health as one of the service providers. My name is Chan Tang-chuk, and I'm one of the researchers and doctoral candidates at a machine learning and data analytics lab, in short, MedLab, which is part of the Friedrich-Alexander-Universität Erlangen-Nürnberg, or also known as FAU. The MedLab is part of the Department Artificial Intelligence in Biomedical Engineering, and the head of the lab is our Professor Björn Escoffier. The team comprises of 9 postdocs and around 40 doctoral candidates, which are experts in various research fields. But to give you an excerpt, some of our expertises lie in experimental studies, and another hot topic at the lab is the research in human gait and motion analysis. And the insights that we get from this research can be relevant for Parkinson patients, for example. We also have experts regarding wearable computing and handling of IMU measurements. And of course, some of our researchers focus on advanced data analytics and AI development in general. So what is our role in TEF-Health? On the one hand, the FAU owns several laboratory facilities that we would also like to offer as rentable TEF-Health services. Some of them are shown in the images at the right. One of the facilities is the biomechanical motion analysis lab for full body motions. While our researchers use it mostly for sports analytics, usage in medical context is also possible and has also already been done. Another example is the gait analysis lab with real-time feedback in virtual reality environments. Our sleep lab is equipped with various radar modules and other sensors, allowing full-scale sleep analysis and sleep staging. And last but not least, we also have a stress and mood induction lab to analyze biosignal data and video-based motion and facial expression. Next to these facilities, the MedLab offers several other services. As our researchers took part of dozens of projects in various scales, we are confident to offer consulting and project design from the ground up. Of course, we also provide help in data acquisition, analysis, and evaluation, as well as hardware and software evaluation. Moreover, one of our most important services is providing ready-to-use open-source frameworks for biomechanical analysis and machine learning evaluation. The target group for our services are small and medium-sized enterprises. SMEs tend to face challenges that big companies often do not know, some occurring specifically in digital health and medtech. One main problem is the lack of access to high-quality validated data for training and testing AI models. High infrastructure costs make it nearly impossible to conduct clinical-grade validation. Especially in the health sector, are many regulatory requirements to consider, and the AI Act and MDR are getting stricter by raising the bar for evidence and transparency. Without robust evaluation pipelines, it is very difficult to meet all these requirements. And moreover, SMEs are usually highly specialized, so they have limited knowledge and expertise in broader areas like multimodal signal analysis. By not tackling these problems, and so without validated data, methods, and facilities, SMEs risk delays or market access failure. TEF-Health's mission is to help SMEs to overcome these challenges, and FAU tries to play an active role in this mission. With our consulting services, we can offer guidance from the earlier stages, starting with just an idea, by helping with the project design or initial AI model development. In later stages, we can further provide support with our dataset services, including prospective data acquisition, but also database standardization and testing for biases. Finally, our lab facilities allow us to offer testing services, not only for general, but also for various specific use cases. On top of these three key types of services, the MedLab offers open source frameworks which are already ready to use. This poses significant cost savings from eliminating licensing fees and also allows greater flexibility and customization. Using our services gives SMEs the great advantages to get accelerated validation by outsourcing the task to experts, as well as independent verification to meet regulatory requirements. It also allows scalability ranging from small feasibility studies to larger validation trials. It reduces time and costs by avoiding high upfront investments in labs and datasets. And finally, our services provides access to expertise and state-of-the-art knowledge. So how do our services actually transfer to reality? In order to explain this, I would like to introduce you to a recent case study first. The medtech company B-Medic reached out to us in the past to develop an AI model for respiration tracking based on RGB and infrared camera footage, and then also to validate the model by comparing the results with a gold standard method. Based on this case study, I prepared a slightly more general example to show you in which various ways our services can be used. So for our hypothetical example, let's say a startup developed a video-based respiration tracking device. While the hardware already exists, the startup lacks the expertise in developing a robust AI model to predict respiratory signals based on the recorded footage. The company also needs to prove the device's accuracy and clinical relevance in order to actually attract investors and gain regulatory approval. In this hypothetical case, the MedLab can offer at least 5 different kinds of services to support the startup from the beginning to the end. With our expertise in project design, we can help the startup to set up an experimental study. Our stress and mood induction lab is the perfect place to collect prospective data in a highly controlled environment. Since our lab has several experts in biosignal processing, we can also lead the development of a robust and accurate AI model to predict respiratory signals. Of course, the prediction results have to be analyzed and interpreted afterwards, and data analysis and evaluation are the biggest strengths of the MedLab. And finally, we would also offer the service of providing a detailed report regarding the outcomes and give recommendations for possible improvement of hardware as well as software. So what to do if you are in a similar situation and are interested in our services? The easiest way to engage with us is by using the shown link here, which directs you to the official TEF-Health homepage. In the main menu, you can find the service catalog, and the service catalog has the option to filter per organization. Choosing FAU gives you a detailed overview of all our services, and it also allows you it also shows you the option to directly contact us by simply clicking on the shown mail icon. So that's all about our role in TEF-Health. If you are interested in the MedLab in general, I would advise you to visit our website or our LinkedIn page. Or if you're looking for more personal contact, you can also reach out to my colleague Amaresa or me per mail. Yeah, so that's from my side. Thank you for your time and attention.
Thank you very much. And with this, I hand over to Lola to chair the question and answer session. For your information, the webinar has been recorded and will be available on the TEF-Health website via the YouTube channel of TEF-Health.
Great. Thank you, Petra, and thank you, Tranchuk, and Jeremy also. And we're just going to give the room now if we have any questions from anyone in the audience that you would like to ask to either FAU or to IHU Strasbourg. Now is the time, and then you can ask your questions. And if not, they already share their contact details. You could also directly write them emails or connect to them on LinkedIn, or better still, just check on the knowledge graph of TEF-Health, then you could contact them directly if you're not able to ask your questions now. Okay, not seeing any questions. I think that's good. So in view of no question, just to let you know that we still have upcoming webinars that would focus a lot more on the fiscal services, to deep dive into understanding all the services that are being offered within TEF-Health. And we would have an upcoming webinar where we would look into the ballpark of the fiscal services within TEF-Health, and you will get to understand the different case studies that go with when it comes to using the fiscal services within TEF-Health. And so in view of that, that would be all from my end, and I would hand it over to Petra for the closing remark.
Thank you very much, Lola. I thank everyone for presenting and attending the webinar. As mentioned, you can find more information on our website, and feel free to contact us anytime with your questions. Thank you so much. Have a great day and see you soon. Bye.